Welcome back to Dementia Caregiving for Families. I am pleased, so pleased to bring to you today my guest, Kimber Westmore, who is the creator of PillMap. And part of the reason this is so near and dear to me is because it actually benefited me and my family. And you will need to listen to the episode to actually hear the story related to my family and PillMap. But while I have you here, if I resonate with you, I'm extending you a very special invitation. For the first 54 families, I am inviting you to become a founding member of my brand spanking new group coaching, low-cost group coaching program. The benefit of joining as a founding member is because I will be giving the 54 founding families the ability to stay in the community for the length of the duration of their walk with their loved one. If that is 2 years, you get it for the same price. If it's 10 years, you get it for the same price. So there's a tremendous benefit to you to join a community like this where you pay a one-time flat fee for the remainder of your family's life and walk and be in a community of like-minded people where our emphasis is really on truly decreasing the stress and the burnout of family caregivers using evidence-based strategies. So I invite you to be a founding member. If you're not a founding member yet, jump on the bandwagon, 54 families, and then I'm going to open it up to the greater community. And message me on Instagram and we will send you the information. But don't delay. This is important, guys. We can come through this dementia caregiving journey with less stress, protecting the things that we love, which includes the love of our entire family, right? Not just the person that we're taking care of, but our entire family. And guess what? You, as a family caregiver, count in that I love my family. You are a part of the people that need to be taken care of. And it's time to stop putting it off. And it's time to take it off of the back burner and put it on the front burner before you actually do burn out. So I invite you to join our new community that we are growing as a founding member, the first 54 families. But without further ado, here is Kimber Westmore from PillMap, and listen for my personal story related to how I was able to avert a crisis. Hey there, success seeker. Welcome to Dementia Caregiving for Families. Do you feel overwhelmed with the daily struggle of dementia caregiving? Looking for an easier path? You're in the right place. On this podcast, we teach you the skills to simplify caregiving. We unravel the mystery of dementia and guide you through the often difficult behaviors. I'm Lizette, your host and fellow family caregiver. As an occupational therapist, I bring my professional and personal experience to this community. Here we speak the truth, but without the verbal vomit. I know you will find value in today's program, so buckle up while this flight takes off. Well, welcome back to today's episode of Dementia Caregiving for Families, and I am very excited about my new guest today. Her name is Kimber, and the reason I am so excited is because I actually use her product with my mom and dad. And we met through LinkedIn online when I saw her post something about her product. And I'm like, ooh, I need that. And what a blessing it has been. And later on in our conversation, I'm going to tell you guys the story that actually happened recently with my mom and dad using Kimber's product. So Kimber, would you like to introduce yourself to my audience?
I would. Thank you so much for giving me this opportunity to share my journey and the reason that I created PillMap. My career is in fire life safety training. So I'm responsible to prepare people in commercial properties for the unexpected. So earthquakes, fire, medical emergencies, power outages, etc. That is my career. And what was a little unsettling and what took me by surprise was when my parents both had extreme emergencies within a 3-month period, I was not prepared. It had never even crossed my mind that my parents would need my help. I had no information about their life, their doctors, their medications, because they were living independent lives. They were traveling, they were, all their children were grown, they had grandchildren, and we just were applauding them for living these healthy, independent lives. So when this happened, suddenly it landed on me to work with doctors and pharmacists and all these different medical care people that were going to help my parents. And I'll say my mother broke her neck and my dad collapsed. He already had dementia and he collapsed of a heart condition. So this all happened in 3 months. And I was just overwhelmed with the responsibility of trying to keep them safe and healthy because their medications kept getting messed up. So I'm sure anyone listening to this that's dealt with medications realizes that that's the cause of so many hospital readmittance, falls, injuries, and there's no, in my mind, there's no reason for it.
Right. I will tell you that having been a professional caregiver in hospitals and seeing the tree that was cut down for the paperwork for coming home from the hospital with somebody with this 25 lists of medications and arrows saying stop taking this and an arrow saying start taking this, and I'm like, I'm not a dumb human and I work in healthcare and I cannot figure out that form. So I have no idea how family caregivers or even people themselves, when they get home, how they truly understand. And the healthcare system thinks that is a simplified system, and it is not. It is not simple at all. So tell us about PillMap. Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below.
Well, PillMap started, the original PillMap was a piece of paper that had each of my parents' pills. I had one for my mom and one for my dad. And I taped a pill, each pill, whether it was a blue pill or a white pill cut in half or a little gel pill, it didn't matter. I taped each one with clear tape over it, and I wrote next to it the name of the pill, because remember, this is a foreign language, I'm sure.
Oh yeah.
I'm preaching to the choir. It's the medical industry thinks that when they tell you Pradaxum, Tropolol, that
nobody knows what that stuff is.
No, you can't even remember it when the minute they say it, it's in and out of your mind. So I would write the name of the pill, and then below it, I would write what it's for. Oh, this is to lower blood pressure. This is a blood thinner. This is for pain. And because I needed to understand it, and guess what? I was not going to be with my parents, both of them, 24/7. So I had to feel comfortable that whoever was with my mom and whoever was with my father, and if they were going to be giving them medications, that they knew what they were and what they were for and when they were supposed to give them to them. Because even the when was, very important. And when they discharge patients, there's typically a 24 to 48 hour window of, they send the patient home. They've gotten them so healthy enough to go home. But now they're trusting the family to read those pieces of paper that you were talking about, right? The stacks of paper, understand them, and keep that person alive until that nurse comes to help reconcile the medications.
Don't even get me started on that.
Yeah. So I'm laughing about it now because we're 6 years later, but the loss of sleep, the anxiety, the tears from myself with this huge responsibility and love for my parents. And then we have a huge family, and they're smart. I have a daughter that's a nurse, my brother's a doctor, and everyone's smart enough to handle this, but you add the emotion of possibly losing the one you love on top of trying to learn a new language, medications. It's
fatigue.
It's a setup for failure. Yep. And then the hospitals are getting people back there, not because the people are sick or more sick. It's because the medications were given wrong. Right. So there's a cycle that goes on with the hospitals that hospitals are even docked for people who are sent back readmittance due to medication errors. So it's a problem that everyone's trying to solve. And there's apps and there's all kinds of things, but I could not find one thing online that just did the practical, that just told the truth for my parents, that spoke for them.
I'm so glad you mentioned the apps, because there are a lot of medication apps and I think they absolutely serve a purpose for the right people. But when you're helping somebody who has cognitive loss, one of the first things they start to struggle with, and everybody will tell you this, well, mama can't use the TV remote. Well, mama can't use the cell phone. Well, there goes an app. Then the app is no good anymore, because mama is 80 years old and mama didn't have a cell phone when she was 17 like our children do now, but she had something in her hands. So tell people what the difference is between a pill box and PillMap.
Very important, because a lot of times I think there are probably 100,000 different pill boxes.
Right.
That people use. It's practical. It's straightforward. We would fill, this is an example, but we would fill, this is 1 week. We would fill 3 weeks in advance. Our family, we'd sit around the table and we go, okay, let's do moms. And we would fill that. But still, we were making mistakes. We were, every once in a while, there'd be 6 pills in the morning one instead of 7. Wait, what did we miss? And what would happen is we're looking at those sheets. We're looking at the bottle that came from the pharmacy. And again, it is straightforward to a pharmacist. It's straightforward to a doctor. But to the average person, it's, again, with emotions, it's just not a straight path. It's a very It's a very unsafe path.
Right.
And
And then
in
you
my,
sit and fill the boxes. What happened with me, and my mom and dad or my husband or somebody will talk to me and boom, I make an error. I'm like, leave me alone. Let me
yes,
fill this without being bothered so I don't make errors, because I understand how, how much risk a person has for being readmitted when you make a mistake with their medication.
exactly. It's a huge risk. Even adding supplements. So if someone's taking
Mm-hmm.
certain supplements and the doctor has included a new medication, everyone has to know what that patient is on.
Right.
And you cannot trust the computers at the, with the
Doctor.
medical
Mm-mm.
doctor's office, because they leave things on there that are no longer being used. It's not accurate.
No, it's not accurate. I agree.
So the PillMap is a simple, it's a cardboard, and we chose this. I created this with my adult children. We chose this hard cardboard because you can write on it
Mm-hmm.
and erase with, we provide an erasable pen because medications change so often. That's why we can't make this plastic slick thing. It's practical. And
Mm-hmm.
you fill each, instead of that scotch tape that's on the paper, we created, you open this portion and you add one of each pill. The visual is what makes this gold,
Absolutely.
because my caregiver that I pay can say to my mom, here's your pills. And my mom can say, and this has happened, oh no, I don't take a blue pill. And then the caregiver can say, oh, look, Joy, you do take the blue pill and it's called this. This is from your daughter. So
Mm-hmm.
that gives my mom peace of mind. And guess what? The generic was a different color. So my
Yep.
mom did remember correctly, but then it gave my mom peace of mind.
Yep.
And then we take it to the doctor with us. And what happens is the doctor then looks at it, and these are all real life examples.
Oh, yeah.
Oh, why are you giving her this whole pill? And we said, because you told us to. Oh no, you're supposed to give her half of the pill. And how are we supposed to know that? Well, it says 0.5 on the white paper and on the bottle.
Yeah, but that doesn't mean I have to break the pill.
I didn't know I would break the pill if someone would have explained it in common language, English.
Take a half a pill, not 0.5.
Cut a pill in half, correct. So we cut the pill in half and we put it in the visual so that anyone giving my mom medication knows they are going to give half of that pill because it's cut in half here. So I'm very visual learner as well. So I could read something 10 times. It would take me 10 times, but if I see it, I'm going to know. So you don't really even have to know the language. And like I said, this is a foreign language, but we also have multiple caregivers across the nation that are multiple, from speaking different languages.
Right.
They're all have the gift of caregiving, which we're so thankful for. And they're caring for our loved ones with us. It's often a team effort. And we have to make sure that we're communicating. So it's really a communication guide. The back has all the rest of the information that, say, a first responder would need if they showed up at a house. Contact information, doctors, allergies, insurance, pharmacy, everything is written on the back. And that, again, that's how the person knows to call me. Right. If something happens to my mom that shows up as a first responder, if I don't get, a call otherwise, it's all here. So there were a lot of iterations from that piece of paper that we used for probably a year, and the hospitals and the doctors and pharmacists loved it, by the way, with just the Scotch tape. So that's why we're doing this. Again, my career's in fire life safety. This is a family passion project. We want to lower medication errors and save lives. And when we get the reviews back, we have someone who sells it on Amazon. I have a website, pillmap.com. And so people can purchase it either way. But when people write about it, and I know you have a personal experience with that, we'll sit around, we'll have dinner at my house, and we'll read the reviews of, how that helped them.
So I'm going to share my personal story because I did get one from my mom and dad, because my mom always asks me, now, tell me, why am I taking so much medicine? And what is this pill for? And I started just like you. Mine was a little more lazy. I took the pills and I put them on a piece of paper and I photographed them. And then I wrote that down because I was too lazy to actually find tape. But the same concept for her. But then the medicine changes, right? You mentioned, the pill is the same. It's just a different formulary. My mom takes a specific medication that has always been a small white pill. And this month now it is a oblong brown pill. And it's the same medication, but she is used to that white pill. And now, Lizette, you're giving me this brown pill. I don't take a brown pill, but it wasn't that brown pill that was the problem. I fill up their medication boxes, and I had made her the PillMap for her with her medications, and I had put them down and I'd taken it to her, and she was so excited when she got it because she's like, oh, now I can see my medicine. And I'm like, yes, Mom, this is why I brought it. And 1 week, so she'd had it several weeks. 1 week, one of her medications, which was a different small little brown pill, oblong, not the same shape, was what had run out, and I had to go pick it up at the pharmacy. Well, I had picked it up. It was a super long story. What happened is it was a really busy day, and I'm human. I make mistakes, right? It was the day this podcast launched that I went to go pick up the medication because it had run out and I was taking them to the doctor. So I was going to be at their house, and then the medicine had run out on Wednesday evening or Thursday, and she needed to, I needed to fill it up. My husband was in Romania. I was trying to figure out when I was trying to pick him up at the airport, all of this drama going on. And instead of, like my habit is, to carry her medicine into the house, I had stuck it in my handbag. So no visual cue for me. And I got to the house and I'm trying to put out fires with the podcast launch and picking them up and talking to my husband and all of this stuff going on. And I just forgot, totally forgot. So that was Monday. Thursday, I get this message. My husband and I are at the gym. I get a text from my dad. Mom's, and he told me the name of the medication is not in her med box. Where is it? And he would not have known what medicine it was, what it was for, why it was being taken, if she didn't have that in the house. And immediately, it was her blood thinner. So immediately I'm like, oh, shoot, where is it? And I could not recall that I had picked it up at the pharmacy. So my husband and I immediately, I'm like, we can't even go home. We got to go to the pharmacy at 9. I remember putting it in. I go to the pharmacy. I'm like, I'm here to pick it up. They're like, no, it was picked up on Monday. I'm like, I had no recollection that I was actually the one that had picked it up, right? Because of life happens, right? We're human. And so I go to my mom and dad, and now I'm like, okay, my dad didn't pick it up. It was Monday. It's not in the house, all of this stuff going on. And as I walk out of the house, thinking I've got to go home and look at home where I might have put her medicine, because I always put it in the same spot. When I remembered walking to the car, that's the difference between memory deficits and forgetting. I had forgotten, but I was able to immediately, it kind of backtracked. And I'm like, oh yeah, I picked it up. I put it in my purse, opened my purse, took the pills out, turned around, walked back in, and I put her medicine in. Yeah. But without that visual reminder, they would not have been able to tell me what medicine. It would have been, my mom would have been off of her blood thinner from Thursday through Sunday when I fill up their med box again.
Well, see that's the kind of story that, we hear those. I'm sorry you went through it, but
oh no, it was a
we,
lifesaver. Like legitimately, it's a lifesaver.
yeah, yeah. So when you were talking about that and your dad noticing that something was missing, I don't think I mentioned in the beginning that at the bottom of each, so this is your morning, midday, evening, bedtime. At the bottom, there's a tally.
Yep.
So it would say 6 pills. So if you have 6 pills that you're taking in the morning, at the bottom, you put 6, you add it up, or 3.5, or whatever that is.
Mm-hmm.
So again, when you're looking at that pill box and you don't see 3.5 pills in there, something's wrong.
Right.
So the cross-referencing is really important.
Yeah, no, for sure. Like, and my dad does have a diagnosis of mild cognitive impairment, and my mom does have some sort of vascular dementia from an old stroke when she was super, super young. And I know without a shadow of a doubt, they would not have been able to do this without that document in the house for them to actually reference and look at. Like, she knows she takes a blood thinner, but she wouldn't be able to show you which one it is. Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below.
Or probably when, right? Or how many milligrams?
Oh, no, none whatsoever. Right.
I think one of the iterations of the PillMap, we showed it. We were at 911. My mom had to be taken in. We get to the admittance. They bring her in. I bring a PillMap, and everyone prior to that loved it. Every doctor, pharmacist, first responder, and this woman that was admitting my mom. So my mom's laying on the gurney. There's other people in the emergency room. She's at the computer and she's looking at this and she goes, well, this will do me no good. And I was kind of insulted and shocked. And I'm like, what? And she goes, I don't know what dosage. We did not have on here the dosage.
Mm-hmm.
So here I am, my mom's laying on the gurney, right? And she's there, and I call my guy that's designed the PillMap, and I'm like, could you please add milligram dosage onto our PillMap before we print? And so that's how it's evolved, and that's just answering those like very important basic things that I think the medical community thinks we have a grasp on. The average person, right. I don't know.
Do not even get me started.
Well, they're educated differently, but.
Well, even me as a healthcare provider, though, coming into this now as a family caregiver, the healthcare system is so burdensome and cumbersome and lumbering that even with my background, I struggle to negotiate it. So if people who are doctors and nurses and therapists and so on are struggling, you got to know other people are struggling. I have a question, and this is totally unrelated. Well, it's related, but not related, but I don't remember. Do you have people's code status on that form?
We don't.
So maybe that's something to consider, putting DNR or not, or full code on there.
Yeah, but wouldn't they have to have a signature on there?
It's just a visual there should be another form in the house. There should be
Yes,
another
there is.
form.
Yes.
Right. But putting it on there so that it'll cue the people to go look for the form.
Great idea.
It's
Great
just
idea.
something because my mom and dad elected independently to, even though they don't have anything imminently wrong, they self-selected that they did not want to be resuscitated. So I have the forms in the house, but maybe putting it, DNR or not, or full code on there.
I
so
think
people
there
can-
is an important information part on the back of this. So we
Mhm.
might make one of
Put it
those
in-
lines.
Right.
Yeah,
Or
because we
even
have
put it in the instructions, if your loved one is DNR, you
Add
could
that.
consider to add it on there yourself.
That's a great idea. Thank you.
Yeah. So just a practical way
Yeah.
of helping
Yeah.
improve this wonderful product. So Kimber, tell people how they can actually get it, where
Okay.
to get it, and how to connect with you. And then we will put all of the details in the show notes as well.
Excellent. So you can always reach me at kimber@pillmap.com. And the website is pillmap.com. And
It's
then
a great website, by the way. It's super clean and easy to
it
navigate.
really explains, it gives some examples. Thank you. And we have had, we've added things that we think clarify for people how you could use it to your advantage. Also Amazon. So it's sold mostly on Amazon. We're in every single state because we put a big map on our wall originally and just started pushing push pins. And we'd say, oh my gosh, someone in Michigan just, is being safer, and oh, someone in Florida. So it's just very straightforward that way. But we do have independent pharmacies, home health care agencies, even a few small family-owned insurance companies have bought them from us in bulk. And I'm happy we'll sell these wholesale in bulk because honestly, we're not getting rich on it. Someday, maybe if we can make so many at one time, but we make it locally. We literally put it together in our home, the package with the erasable pen, with the instructions in a bag, where you could carry some of your medications extra in there if you want it. So we just want to get it to you however you want to get it. I'm happy to speak to any group about how to use PillMap. So I've done that quite often. We work with some of the local hospitals, but mostly those one-offs where someone tells another person, or a pharmacist or a doctor tells their patients, hey, go on Amazon and buy this and come back with this filled in. My brother's a radiation oncologist, and they have to do a full review before they start any sort of treatment. And people come in with bags of pills. So
that half are expired.
Yeah. And
they shouldn't be taking anymore.
Right.
Yeah.
And we do have something recently where someone takes a liquid and they also take pills. And so, of course, you can't put liquid in here, but they did. I don't know if you can see this. They said they took a marker and just colored it in and then wrote next to it what that was. And so, people are using it. People are using it for their animals. So,
I totally understand why. And I'm telling you now, I tell everybody, people in my coaching groups and in my membership areas where I serve people in a different way, are buying it just off of my recommendation, because it truly was, it is like, I've been doing this for a very, very long time. There are very few products that I've not come across in my 30 years. And I'm like, this is different and unique and like affordable and practical and truly life altering for people.
Thank you.
Truly life altering. So good job, Kimber. So
Thank
thank you
It's
so much.
an honor, and you're doing great work, and I'm so happy to have met you.
Yeah,
And
me too. This is gonna
we'll continue.
Oh yeah,
We'll
for sure.
continue the adventure. Good job on the
Awesome.
podcast.
Thank you very much, and thank you for joining me today. And this will be, I don't know when it'll come out, but thank you for being here. And anybody who is listening, please go support Kimber on either Amazon or on her website. It's pillmap.com. We'll put the information in the show notes. And if you can't find it, you can always just message me and I'll help link you with Kimber. And please tune back for next episode.
Thank you.
Thanks for joining me today, Success Seeker. I pour my heart and soul into this program to serve you. You can serve me by leaving a review on Apple Podcasts. And join our free Facebook group, Dementia Caregiving for Families. It's a positive and proactive space to navigate dementia caregiving together. Get practical tools and find support, but without the verbal vomit. Be a part of our community where we seek to find peace of mind and ease, despite the dementia diagnosis. So join today and see you next time as our flight takes off.